My name is Richard, and I'm here to do my SVN competency, a small volume nebulizer. First, before entering the patient's room, I would check their charts, check the physician's orders, as well as pertinent information like vital trends, history, labs that may impact the treatment. Afterwards, I would gather my equipment. In this case, it would be a pulse ox, blood pressure cuffs, the SVN itself, as well as gloves, tissues that can capture some sputum, as well as sanitizing equipment if necessary. Once that's complete, let's talk a little bit about the SVN itself. It generally comes in a clear bag similar to this one. That's to keep it sanitized, and after use, it will go back into this, and you would normally leave this behind the patient just in case you need further treatment. The components for this particular one, we would have a reservoir corrugated tube, a tailpiece, a mouthpiece where the patient would breathe through, or wrap their lips around and breathe through. This chamber where the medication is actually going to go, which then attaches to tubing. The tubing itself will attach to a gas source. When you turn it on, it would then nebulize, aerosolize the medication, which then the patient would then breathe into. So once you got everything gathered, and go ahead and knock on the door. Hello, sir. My name is Richard. I am a student of the respiratory care program at Hartnell. I'm here to do a breathing treatment for you today. First off, may I have your name and date of birth? All right, and your name is John Jones. Your date of birth is March 1st, 2000. And just to verify that, I will check your wristband. And that's correct. Go ahead and put on my gloves. All right, Mr. Jones. So, like I said, I'm going to be here to do a treatment for you today. First off, we're going to do check your vitals and just help us assess how well the treatment is going. First, I'd like to check your lung sounds, and I'll be checking it from the back as well as the front, and I would usually start from the base and go straight across, up, and it would be the same on the front. So with your permission, I'm going to roll you to your side. Thank you, Mr. Jones. Sorry, sir. Thank you again. That sounded pretty good, Mr. Jones. Let me help you back to a comfortable position. And with your permission, I'm going to open up your gun a little bit. It's just to give me space to do what needs to be done. It's always a good policy to check for permission with the patient, protect your privacy, and especially if it happens to be the opposite sex, that would be uncomfortable for them, being a man to a woman. So let's check on the sides. And each time you feel the stethoscope, please go ahead and take a deep breath in. And I'm going to listen to a trick here as well. Okay, sir? Thank you, Mr. Jones. I'm going to check the the trachea, to listen to potential obstruction in the upper airways, depending if it's coming from the lungs or the upper airways. So, thank you, sir. And we'll take also your pulse as well as your oxygen levels. So, hold on 1 minute, sir. So, we're going to put this on your finger. And I'll take your pulse. While I'm taking his pulse, I can also check for his chest rises to count his respiratory rate. All right, Mr. Jones, I'm going to leave the pulse ox there for you. Hopefully it's not uncomfortable. I count his heart rate at 40 in 30 seconds, multiplied by 2, that's 80. That's within the normal range. His respiratory rate, I count at 8 in 30 seconds. I multiply it in 2, I get 16, again within normal range. Oxygen rating, oxygen saturation, I'm looking at 98. All right. And at this point, we're going to do your blood pressure. Let me just pull up your sleeve a little bit, Mr. Jones. Thank you, sir. And with this one, you would find the brachial artery. And go ahead and wrap the cuff with the indicator approximately where that artery is found. I'm going to place this right over here for you. So let me know if it's uncomfortable for any reason, Mr. Jones. Okay, Mr. Jones, thank you so much. So I got a blood pressure of 135/90. Is that normal for you, Mr. Jones? All right, sir. At this point, we go ahead and do the treatment. So, Mr. Jones, we're going to be doing an SVN, small volume nebulizer. We have a medication here for you, which is called Duaneb. It's a combination of bruvanol and tropium, and it's going to help open up constricted airways. It is at this point kind of restricted, kind of making it difficult for you to breathe. With this being applicated, it will open things up a little bit and definitely help you breathe better. There is a bit of a side effect, which includes a bit of tremors, maybe increase heart rate, and those are normal. If it does become uncomfortable or worrisome, just give us a call. There are call buttons here on the sides. Just summon us if you ever need to. So the way this is going to work is going to hook this up to the gas source.
I'm going to go ahead and gather my equipment. I'm going to be using a peak flow, a spacer, the MPI, my stethoscope, gloves, sanitizer and post-it.
The canister.
Hold on.
And it comes in a dose like this. The dose, you simply open it up and go ahead and fill it completely, squeeze everything out, attach it back into the T-piece, and place the gas source in the bottom. When we turn this on, it would set the flow meter to 6 to 8. So that's this point. We'll just go ahead and put it at 7. To know if the medication is working, there would be mist that would come through the mouthpiece as well as the reservoir in the back. Okay, Mr. Jones, this is where the medication is going to come from. You're going to want to hold it straight up like this one. Therefore, make sure the medication is upright. Therefore, otherwise, it's not going to get the medication that you need. You just wrap your lips around here and go ahead and breathe normally. Exhale and breathe normally. And every 5th breath, go ahead and take a deep breath. Hold it for a little bit, and then exhale through your nose. The treatment normally lasts between 5 to 15 minutes. For sake of time, the save has already been 15 minutes. When the medication is running low, it would start to sputter. You would tap it a little bit so you can get more of the medications out. Once that's completed, okay, Mr. Jones, the treatment is complete, so I'm going to take this back from you. Turn off the flow meter. If there is more medication left in the container, you would dump this in the sterile sink. Otherwise, the equipment goes back into the plastic bag where it came into. Tube and all. And the bag will be left with the patient behind their bed for potential further treatment when needed. All right, Mr. Jones, we're going to take your vitals again just to make sure everything's okay. Let's see if there's any improvements. All right, I'm going to listen to your heart, to your lung sounds.
That's okay with you?
I'm going to roll you over to your side. Just let me know if it's uncomfortable. Thank you, Mr. Jones. Okay, Mr. Jones, thank you. Let me get you back to a comfortable position. And like before, I'm going to check your lung sounds from the front. I'm gonna, with your permission, lower your gun a little bit.
Okay, I'm gonna do the front. I don't have to put it.
Well, I was just next door. Oh, I didn't know. And this guy's site. Okay.
And listen to your throat once again. All right, thank you, Mr. Jones.
You wanna take a
Now we're gonna do the check your oxygen levels again, as well as your pulse. And again, while checking for the pulse, I can also check for the respiratory rate.
There is some side effects with albuterol. You might feel like tremors or your heart racing too fast.
I know. Pretty soon we're gonna have all the chamber stuff and see that dressing.
Something else.
Like in a week or two.
Okay, Mr. Jones, thank you so much. I'll take this from you today. So I've got a respiratory rate of 6 times 2, that's 12. Pulse rating of 35 times 2 after 30 seconds, and we're getting 70. Pulse ox showing at 97% saturation. We'll go ahead and take your blood pressure once more. We're almost done, sir. Thank you for being patient. Again, look for the brachial artery.
I highly recommend the use of spacer to make sure that the spacer is good, because sometimes when you press it, it can come out too fast, and with the spacer, you can slow it down and go make sure you get it in your mouth. You want to do two first? Okay.
I'm going to place this on your side, sir. All right, thank you, Mr. Jones. So I got a blood pressure of 125/80. One thing is if I could have you cough into this. So in the beginning, I would have the patient cough, and see if there's any sputum that comes out, and we can assess that. And at the end of the treatment, to have him cough again to come up with any sputum, if any, and assess that. And so we'll go ahead and cough.
Do you need a pillow or you can make it purchase?
If there's anything, you go ahead and assess that. And there's usually a cup where you can collect a specimen and put it in here. All right, thank you, Mr. Jones. Is there anything before I leave that you would need to make you more comfortable? No? Alrighty. Just to let you know, you do have call buttons on the side of your rails, here on the other. If you need anything at all, any questions, or you feel anything, any discomfort because of the treatment, just please call and I'll come down as soon as possible. I'll be around here for you, so if you need me, please summon me and I'll be checking on you in about 2 hours or so. All right, Mr. Jones? Thank you, sir. And before leaving, go ahead and remove the gloves. Dispose of it. And hand sanitize. And leave the room with your equipment. At that point, you can go ahead and chart your results, your heart rate, respiratory rate, blood pressure, sputum samples, and chart that accordingly. And as well as your lung sounds that might be pertinent to the charts. All right, and I believe that's everything. Thank you for listening.